Amazing. Okay, so part one. Today's lesson is very easy because we're going to be talking about the oral cavity in general. Now, if you're a dentist student, this part will not be in the self-control test, but it will be in the oral examination. Do not ask me how is it possible, but basically dentistry students, you guys do not learn this whatsoever in your lessons, yet this is a topic in the histo final oral if you have that final oral. Okay, so this is why it's going to be very useful for you if you're a dentist. For medicine, it's going to be asked in the self-control test. Okay, so let's begin. So first of all, oral cavity. Of course, it is very understandable. What is oral cavity? This is your mouth itself. We have two parts of the oral cavity. We have the oral vestibule and the oral cavity proper. Where is the oral vestibule? This is the space between your teeth and your lips, right? So it's behind your lips, but anterior to your teeth. So where you brush your teeth, this is where do you put the brush itself? You put it into the oral vestibule. Oral cavity proper is the space which is going to be behind your teeth all the way to the oropharynx. In anatomy, you will learn what is oropharynx, but oropharynx is basically a little bit behind the arch of your mouth. You know, like when you open your mouth, you can see something hanging there. It's called uvula. So right behind this uvula, this is the place called oropharynx. So oral cavity proper is from the back of your teeth all the way to the behind of the uvula. Structures inside. This is understandable. Somebody tell me, what is gingiva? This is a medical name for it, but in English, how do we call it?
Is it the gums?
Yes, this is the gums, right? So gum, this is this pinky tissue, which is covering the jaw itself, right? So the bones of the jaw. There is something which is called palates. In anatomy, you're going to learn that there are two of them. One of them is called soft palate. One of them is called hard palate. Anybody knows what is hard palate in your mouth? If you were to specify, like if you have to ask yourself, where is hard palate in my mouth? What would that be?
It's gonna be at the top,
The roof
of my
of
mouth.
your oral cavity.
The
So
roof, yeah.
you use your tongue right now and you kind of slide the roof of your oral cavity. This is hard palate. What is the soft palate? It's this, the uvula. Okay, so everything at the back of your oral cavity, those soft tissues, the uvula which is hanging down, this is the soft palate. The rest of it, you know, anybody knows what is the function of the tonsils? At least to which system do they belong, tonsils?
Immunity system, they are like a
Immune
filter
system,
thing.
very good. So tonsils, we're going to talk about them this self-control test as well. They are little aggregations of the immune tissue. They consist of a bunch of immune cells. And agree with me, this is very logical to have lots of tonsils in my oral cavity, because oral cavity is the place where I constantly introduce new things to by eating, drinking, right? I don't know, sucking my pen constantly when I'm stressed. So constantly bacteria are being introduced into the oral cavity. So tonsils are right there to protect. Now, this is a little bit of a repetition from last semester. This is a very good question to ask in the oral examination. By the way, if you're unfamiliar with my methods, especially this semester, I'm constantly going to tell you, this is for the SET, this is for the oral. Okay, so there are some questions that are typically asked in the oral examination, and there are some questions which are typically asked in the self-control test. So this question is typically asked in the oral examination. So they love asking you this question. What is mucosa? So if I ask you, what is mucosa? How would you answer? We kind of talked about it last semester. What is mucosa?
It's a lining for protection.
It is, okay, so it is there for protection, but for example, do I have mucosa on my skin?
No.
No. So which systems possess mucosa?
Internal organs or?
All of them. So for example, heart is an internal organ. Does a heart have mucosa? It doesn't.
No.
So there are only two systems in our body that have mucosa.
Digestive and respiratory.
Perfect. Digestive and respiratory system. Those are the two proper systems that have mucosa. This semester, we're going to learn some exceptions. For example, vagina, it's also possessing mucosa as well. We're going to learn those exceptions, but generally speaking, from last semester, respiratory and digestive system, they both possess mucosa. Could you tell me what do they have in common? What is in common between a respiratory system and digestive from histological perspective? What do they have in common? They both are luminous. What do I mean by that? They both have a lumen. They are both tubular structures. So if you look at your respiratory system, it has trachea, it has bronchi, it has a bunch of alveoli here, and etc. Do you see? It is a lumen, it is a tube. The same goes for your digestive system, of course, except for the mouth. We go esophagus, we go stomach, we go small intestine, large intestine. It is basically one huge tube. So if we do a cross section, right, a cross section of this tube, let's take a look at esophagus. We do a cross section of esophagus. What is the first layer? What is this? This is the lumen of the esophagus. This is the place where the food is going through. What is this layer?
Epithelial cells?
Epithelium cells are going to be right here, right there, the first layer of this layer. This is going to be mucosa, guys. The first layer, which is facing the lumen, this is mucosa. So now I want to ask you a question. What does mucosa consist of? What are the two layers that are making up mucosa? I think Roshan just said. So epithelium and
connective tissue.
But in here, we call this connective tissue differently. It's a very special connective tissue.
Stroma?
Starts
Lamina
with
propria.
L, lamina propria. So what is mucosa? Mucosa is two things. It is epithelium, the surface epithelium, whatever we have right here, right? And the underlying connective tissue. This connective tissue is very special. We call it lamina propria. What is special about lamina propria?
It contains antibodies, like
Say better, not antibodies, but lamina propria contains lymphocytes. Lamina propria contains lymphocytes. Our connective tissue, like in my skin, it doesn't contain lymphocytes. We don't need it there. Why lymphocytes are needed here? Why is it important?
Because like we're introducing new stuff, like for example, food, which may contain pathogens, air may also contain pathogens.
Exactly. So do you understand a little bit, right? So we have two systems. We have two systems where the mucosa is present, digestive and respiratory. When you're inhaling, there's lots of pathogens in the air. Where you're eating, drinking, there's lots of pathogens in that. What is in common between the respiratory and digestive system? They are both tubular systems. They consist of a bunch of tubes. These tubes have a lumen inside, right? So there is a lumen inside of the structure. What is surrounding the lumen? What is the first thing which is facing that lumen? mucosa. So this area right here, this is known as the mucosa. The question in the oral that they're going to ask you is, what does mucosa consist of? What does it consist of? It consists of two layers. The top layer is epithelium, and the bottom layer is connective tissue. Do not forget that these structures, like your respiratory or digestive system, are very tubular structures, and they're facing outside. They're constantly dealing with the stuff from the outside. So it is logical for this connective tissue to be filled with lymphocytes. As a result, this connective tissue is very special. Hence, we're going to call it lamina propria. So mucosa consists of two things, epithelium and lamina propria. Is it clear? Okay, what is under mucosa? So what is the next layer? Under
Connective
mucosa.
tissue.
Submucosa.
Submucosa. And submucosa is your connective tissue, yes. It's another type of connective tissue. It can be loose, it can be dense. It depends on the organ that we're talking about. What is under submucosa? Well, it depends. We're going to see the differences in respiratory and digestive systems. This is where the difference comes in. It's not important right now. I'm just telling you generally, after submucosa, we have a muscle layer. And this muscle layer in Latin is going to be known as the muscularis layer, right? So external muscular layer, muscularis externa layer. And the most outer layer could be just some kind of epithelial cells or covering cells. We're going to call them serosa or adventitia. So this is generally the way of layers. So could we do it again, please? So no longer drawing a lumen, because you understand that this is a lumen, right? So this right here, this is a lumen, a space, be of esophagus, trachea, doesn't matter. What is the first layer?
Mucosa.
Mucosa.
Tell me, what does mucosa consist of?
Lamina propria.
What is the
Lamina.
first thing?
Mucosa.
Epithelial tissue.
Epithelial tissue. Okay, so this is where the epithelium is going to be present. Under it is the lamina propria. Together, epithelium and lamina propria is known as the mucosa. What is under mucosa?
Submucosa.
Submucosa. What is under submucosa?
Muscle layer.
Muscle layer, muscularis externa, and the top, right, the most superficial layer. This is going to be just some kind of epithelial tissue, which is covering an organ. It could be either serosa or adventitia. I repeat, we're going to learn details about it later. This is just an introduction to you, so you already heard it. Okay, so when we do it again, you already have heard it. Which kind of mucosa do we have in the oral cavity? There are three types of them. There is a lining mucosa, masticatory, and specialized. The easiest one, in my opinion, is a specialized mucosa. Could you tell me what is so special in your oral cavity?
Enzymes.
Enzymes are special, but there's only one enzyme which is in the oral cavity. So what is special in your oral cavity that is sensing things constantly?
Oh, tasting, you mean?
Tasting, of course, the tongue. Tongue is a very special structure in your oral cavity because it is capable of tasting things. What is tasting things? Taste buds, right? For sure, you have heard this couple of words together before. So taste buds. Taste buds are specialized mucosa. That's what they are. If I have to ask myself, what is a taste bud? It is a specialized mucosa. We'll talk about it right now. Lining mucosa. Tell me, which structures do you think in your oral cavity are lined by lining mucosa? So
do you mean like the microvilli?
Sorry?
Do you mean like the macrovilli?
No, no, no. You're
The inner
confusing
cheek.
us here. Microvilli are on the epithelial cell itself, right? So they're on the epithelial cell right here. I'm asking about lining mucosa, the entire layer. Where could it be in our oral cavity?
Cheeks.
Very good. Cheeks, the inner part of our cheeks. So the inner part, if you, again, touch it with your tongue, it's very smooth. So definitely this is lining mucosa. Anywhere else?
Gingiva, maybe.
What is gingiva participating in? Not directly, but it is participating in. It is participating in this process. What is mastication?
Chewing.
Chewing. So masticatory mucosa is going to be present on your gingiva, on your gum. Your gum itself, the gingiva itself, is masticatory mucosa. Yes. The inner lining of your cheek is lining mucosa. Okay, and let's take a look. So lining mucosa, you're going to see inner surface of the cheeks, lips, and most importantly, soft palate. Do not forget, where is the soft palate? This is the back of your mouth where the uvula is hanging, right? So all the way at the back of your mouth, you're going to see that's where the lining mucosa is. Could you tell me, how do we call this together?
Mucosa.
Mucosa. So our question right now is to understand what exactly lining mucosa consists of. It's going to have a non-keratinized epithelium. And the connective tissue of it has more elastic fibers than collagen, right? It has more elastic than collagen. This is why I can stretch my lips, I can stretch my cheeks, and the mucosa there is not tearing apart. It's staying as it is because the lamina propria there, the connective tissue, it has more elastic fibers. Could you remind me? Non-keratinized, stratified squamous epithelium. Which layers does it have? How many layers does it have?
3.
How do we call them?
Stratum granulosum.
The most bottom layer, how do we call it?
Stratum basale.
Basale. On the top of it? Spinosum is everywhere in the world, in our book as well, except in this university. This university has another name.
Stratum polygonale.
Polygonale, very good. Okay, so this is from the book. In your lectures, they're going to put another name. They're going to put polygonale, right? So the second layer is going to be polygonale. And what is the last layer? The one facing outside. In the book, in the world, we call it superficiale. In this university, we call it nothing?
Planocellulare.
Plancellulare. Okay, we're going to call it plancellulare. So I repeat, in this university, we do not use the book ones. We do not. We have our own for them. So the non-keratinized epithelium has 3 layers. It is called basale. This is the most basal one, the most bottom one. Then we have polygonale. Then we have plancellulare. Could you tell me, how do you know that the epithelium is non-keratinized? You're looking at the slide. How do you know it is non-keratinized?
The uppermost layer is thick.
It won't be as thick because you're confusing with the keratinized. In the keratinized, it will be thick for sure.
There won't be nucleus for the keratinized, and it's gonna look blue.
So hold on. In the non-keratinized epithelium, the most top layer, is it alive or is it dead?
Not alive.
It's alive. Because keratin is a protein that we put into dead cells to keep them there, right? You remember I told you zombie taxidermy, you know, when you stuff an animal to make it look like it's alive? Keratin is the same way. The dead cells get filled with the keratin to look like it's alive. But how do you know if a cell is alive? If it is alive, it must have
Nucleus.
a nucleus. So how do I know if the epithelium I'm looking at is keratinized or non-keratinized? All I have to do is look at the top layer. If the epithelial cells in this top layer have the nuclei, they're alive. So the epithelium is non-keratinized. If I do not see the nuclei in the top layer, they are dead, hence keratinized. Could you tell me where do I have keratinized stratified squamous epithelium?
In the skin.
In the skin. Your epidermis, the top layer, is stratified squamous, keratinized epithelium. It's dead. This tissue right here is dead. Now, in your lining mucosa, it's alive. It doesn't have the keratin, and instead it has the nuclei. So is it clear?
I have a question. Why don't I just look at its color and then I can judge?
Because sometimes you add a little bit extra hematoxylin and the top layer looks blue. So you still have to magnify and make sure that you do see the nuclei or you don't see the nuclei, because color is a useful superficial technique. So what are we talking about for the rest of you guys? Keratin has a color. So keratinized epithelium, the top layer will be darker, okay, than the rest of them. But still, sometimes it could be a mistake of a histologist. So to make sure that this is a keratinized epithelium, you still have to magnify into this layer right here and look for the nuclei. If you see the nuclei, this is a non-keratinized. If you don't see, this is a keratinized. Okay, so epithelium understandable, lamina propria understandable. Okay, so this will for sure be asked in the self-control test. They're going to ask you which epithelium is in the lining mucosa. What fiber is dominant in the lining mucosa? Again, elastic is the dominant one, hence I can stretch my tissue apart. This mucosa is attached to the submucosa. And submucosa is just your normal connective tissue, which possesses submucosal salivary glands. Okay, so nothing interesting. We move on. There is something which is called para-keratinized epithelium. And this is very special because we just said that keratinized epithelium, does it have the nuclei? Nope. Does it have the keratin? Yes, it has. Non-keratinized epithelium, does it have the nuclei in the superficial layer? Yes, it does. Does it have the keratin in the superficial layer? No, it doesn't. So what do you think para-keratinized epithelium looks like?
Has both.
Has both. Has the nuclei and it has the keratin. This is a mix in between the two tissues. Think about it this way. Let's imagine the following situation. You have non-keratinized epithelium, right? So somewhere here. Let's imagine this is my inner cheek. And I'm a person who is constantly chewing on my right side. I take a bite of an apple and I start chewing on my right side. Agree with me that if every day I keep chewing on my right side, my inner cheek keeps getting damaged, right? Because this is a non-keratinized epithelium. It is very thin. It doesn't have the keratin to protect the tissue. Whenever you hear the keratin, think of the skin. Skin is a tough tissue. It's capable of protecting the rest of your body. So imagine if I'm constantly eating on the right side, right? My mucosa there has no keratin. Every time I eat, I damage a little bit that mucosa. What is our body great at? It's great at adapting. So what happens is that if our body recognizes that you're constantly introducing pressure or damage or trauma to a certain part of the lining mucosa, what are the cells going to do there? They're going to just add a little bit of keratin into that area. Does it make it keratinized epithelium? No, because the nuclei are still there. This is still non-keratinized epithelium. The only difference is that you have added a little bit of keratin into the cells to protect that area from further damage. What am I describing right now? I'm describing para-keratinized epithelium. This is a very stupid question by one of the professors in the oral examination, but it's still a question. If you have to classify para-keratinized epithelium as non or kera, which one would you classify it as? If you have to choose to put this one to here or to here, where would you put it?
Non-keratinized?
Non-keratinized. Para-keratinized technically is a non-keratinized epithelium. It just has a bit of keratin in it. Very important to remember, again, mnemonics are very useful. Para-keratinized epithelium possesses pycnotic nuclei, PP, okay? Para-keratinized cells, para-keratinized epithelial cells have pycnotic nuclei. Pycnotic nucleus is a very dense nucleus. So if you draw a cell, right, this is a cell, you always draw nucleus as a big structure, very kind of spread out, very light, and etc. Pycnotic nucleus looks like this. A little tiny black dot. It's still a nucleus, but it's not the same nucleus as we see in other cells, right? So pycnotic nucleus is a highly condensed nucleus. Is there any question here? Okay. So what I want to tell you, lining mucosa has non-keratinized stratified squamous epithelium, but in the self-control test, if you see a question like this, lining mucosa possesses only non-keratinized stratified squamous epithelium, would you choose that option as the correct one?
No.
No, because it doesn't have only non-keratinized one. It also, in some places, has para-keratinized. In which places? In the places which experience the most pressure, the most trauma, the most damage. So I repeat, lining mucosa is not possessing the non-keratinized epithelium everywhere. In some places, you will see para-keratinized. Okay, masticatory mucosa.
Wait,
we will not be, yeah?
about the pycnotic cells.
Yeah.
I mean, if the cell was, I mean, like if the nucleus was actually small, which means that then it's not going to do its proper function.
For sure, yes, it's not going to do its proper function, for sure. Yes, that is true. But still, it is considered to be, I'm sorry, guys, my cat is going crazy. It's not a normal nucleus, but it is still a nucleus. Yes, so do you understand what I'm trying to tell you? It's still a nucleus. It's for sure will not do the proper job because it is very condensed. So all of the genome there is not doing the job properly, that's for sure, but it is still a nucleus. And because it is still a nucleus, you would classify it as a non-keratinized. Okay? Just a sec, guys. Okay, sorry about that. Okay, So now we're moving on to the masticatory mucosa. This is the mucosa which is going to be covering your gum, gingiva, and hard palate. Very important question in the oral that they ask, which structures participate in the chewing, in the mastication process. Of course, it's your teeth. Of course, it's your gingiva, but don't forget hard palate as well, the roof of your mouth, and tongue. Because how do you chew? Next time you chew the food, try to really notice how are you chewing. Part of it is being pushed by the tongue against your roof of the mouth. You keep pushing the food against the roof of your mouth. So masticatory mucosa is most dominant in the gingiva and hard palate. Okay, but you may see a part of it on the tongue as well. So do not forget, this is called mucosa, right? So epithelium together with the underlying lamina propria, we call it mucosa. Which epithelium is going to be here? It's going to be keratinized epithelium. Okay, so now this is very similar to your skin. It's going to be keratinized epithelium here. Why? Well, again, keratin is a very hard protein. If it is present in a cell, it means that this cell has to be protected from constant abrasion, from constant, I don't know, some kind of, I want to say trauma, but not trauma, right? So from constant bugging, okay? So from constant pressure. Where is this pressure in your oral cavity? Well, of course, the food. When you chew the food, it kind of pushes on the top of your epithelial cells. So of course, they have to be keratinized. Most importantly, take a look. Parakeratinized can also be present. So the same idea is here. Masticatory mucosa, does it only have keratinized epithelium? No, okay? Parakeratinized can also be present in some places. Lamina propria, connective tissue, we said, with lymphocytes, but take a look. It has less elastic fibers and more collagen fibers, right? So it's the opposite with the lining mucosa. Hence, you cannot stretch your gingiva, you cannot do anything. It's a very hard tissue. No submucosa, very important. So what is this mucosa attaching to? If there's no submucosa, what does it attach to?
Muscles.
Bone.
Bone. Gingiva, if you ever seen like a tooth removal or something, if you spread the gingiva, there is something white under. What is that white? It's a bone. The same for your hard palate. If you spread it a little bit, there is a bone behind. So masticatory mucosa attaches directly to the underlying bone. Remember this, okay? So there is no submucosa, it attaches to the bone directly. Okay, this is a very good picture because it shows you the difference between parakeratinized and keratinized epithelium, right? You see that the superficial layer is definitely lacking the nuclei, while parakeratinized has the nuclei, but they are pycnotic, right? So this is a normal nucleus. This is a pycnotic nucleus. It's a very, very condensed looking kind of thing. Specialized mucosa. This is on your tongue, of course. Specialized mucosa is responsible for the sensation of the taste. Now, what's important is your tongue has two surfaces. It has a dorsal surface and it has a ventral surface. And this is Short Zoli's favorite question. Why? So if we look at the tongue, okay, how do we do? Okay, let's do like this. I'm sorry for my drawing. Okay, so this is the nose, right? And those are the lips somewhere here, not important. And this is the chin. And this is the neck. The tongue inside looks like this, right? Let's stick it out to make sure that you understand. This is the tongue. This is the eye, right? So this is the superior part. This is the inferior part. This is the anterior part, because it's the head, and this is the posterior. Which one is the dorsal? Is it the top of the tongue or the bottom of the tongue? So if I stick my tongue out, this surface, the surface that you see right now, is it dorsal or is it ventral?
Ventral.
This is dorsal. And the question is why? Why the superior surface, right? This is the superior surface of the tongue. Why is it dorsal? And why the inferior tongue is ventral? What does ventral mean? Very important question by Shortzoli in anatomy. Because lots of students think ventral is anterior. And you're right, ventral is anterior, but it has another meaning. Ventral means closest to the trunk. And where is your trunk? Well, that's where your organs are, right? So closest to the trunk. So do you understand why the superior surface is the dorsal one? Because it is kind of facing away from the trunk, right? If I stick my tongue out right now, I apologize for the view, but if I stick the tongue out right now, which one is closer to the body? Of course, the under tongue, right? So the part which is the under tongue is the one which is facing the body. So the under tongue is the ventral surface. The dorsal surface. Specialized mucosa is located only on the dorsal surface of the tongue, only. So if I lift my tongue right now, which surface was that?
Ventral.
Ventral. I point again, this one.
Dorsal.
Dorsal. Specialized mucosa is located on which surface?
Dorsal.
Dorsal. So which mucosa is on ventral?
Lining.
Lining. Perfect. Lining mucosa. And where do the two mucosas meet? They meet at the tip of your tongue. The tip of your tongue, this is where the two mucosas come together. Let's kind of draw it again. Let's not draw it. Okay. Okay, let's draw it. So again, this is your tongue like this, right? This surface, this is the dorsal surface. This is the tip of the tongue, and then there is the under area of the tongue. The dorsal surface is the one which is the specialized mucosa. The ventral one is the lining mucosa. Specialized mucosa is very special. Why? Because it possesses taste buds. So a question you're going to see in the self-control test, taste buds are present on the ventral surface of the tongue, correct?
No.
False.
It's not correct because the ventral surface of the tongue has lining mucosa, and lining mucosa does not have any taste buds. Okay, let's do the first slide, which is the lip. Okay, let's get over with it. It's your first one. So congratulations on that. We have lip, H and E, hematoxylin and eosin. A little bit of histo 1. What does hematoxylin stain?
The nucleus.
Why? Why nucleus?
Because the nucleus is negatively charged and
Very good.
hematoxylin is positively charged.
Very good. And hematoxylin is positively charged, right? So how would you describe nucleus if it loves hematoxylin?
Basophilic.
Basophilic, very good. So nucleus is basophilic because hematoxylin has a positive charge. So it is a base, right? All the bases, they always have the positive charge. Which other structures stain with hematoxylin? Nucleus, yes. What else?
Ribosome.
Ribosomes. And
Rough ER.
rough ER, yes. Okay, so rough endoplasmic reticulum and ribosomes. What do these three organelles have in common?
Protein synthesis.
Very good. They're responsible for the protein synthesis. So as a result, a cell which is actively secreting, right? Actively making proteins, right? It is actively making them. It's going to be basophilic. Remember that. Eosin, which charge does it have?
Positive.
Negative, right? So hematoxylin has the positive one, eosin has the negative. So hence it loves to stain positively charged things such as
Proteins.
very good. Majority of the proteins have a positive charge. There are just some exceptions that have a negative charge, but majority of them have a positive charge. Yes. Okay, let's take a look at our lip. Our lip is going to contain three zones. We have the skin area, which is right under your lip, right? So right here, right under it, this is the skin, the cutaneous segment. We have the lining mucosa, which is the inner part of your lip, right? So this one right here, this is the lining mucosa. And then there is something which is called a vermilion zone. Vermilion zone is the red zone. It's the one where you put the lipstick on, right? So if I want to put a lipstick on my lips right now, I'm putting it on the vermilion zone, right? So you can see that this is the skin segment. I repeat, it is right under the lip, right here. Then you see the vermilion zone. It's this visible lip, the lip that we see, right? So this is the vermilion zone. And inside the lip, the one which is going to be in the oral cavity, this is the lining mucosa. In the core of the lip, we have a muscle. This is called orbicularis oris muscle. It looks like a circle. You remember this. Which kind of muscle is this? Orbicularis oris muscle. Which muscle is this?
Skeletal muscle.
Of course. How do you know that this is a skeletal muscle?
Voluntary movement.
Because what am I doing right now? What are we doing right now? We're talking. And as we're talking, we're moving our lips. It must be skeletal. If I'm capable of voluntarily moving it, it must be skeletal muscle, for sure. Which nerve innervates this muscle? It's on my face.
Facial nerve.
Facial. This is a cranial nerve, number?
Number 7.
7, yes. This is the cranial nerve, number 7. It innervates all of my facial muscles. Another name for the vermilion zone, it's called a red zone. Okay, because vermilion is just a shade of red. So it's another name for it, it's called red zone. Okay, let's take a look. So this is our lip. Let's try to think as a second-year medical student that already has some kind of histo knowledge. Immediately when you look on the slide, you can see two colors. You can see the blue and you can see the red. So of course, this is H and E. Okay, we can see that there are 3 zones. Zone 1 starts from here and it ends somewhere here because it's the same tissue, do you see? The epithelium is exactly the same. Zone 2 starts here, finishes somewhere here, right? This is the second zone. And this is the zone 3. In the zone 3, I see that there are some kind of structures. What are these? Even with this magnification, you're able to say.
Salivary gland.
Nope. This is salivary gland. What are these?
Hair follicles.
Hair follicles, very good. Okay, so these are hair follicles. If you see hair follicles, this segment must be
Exterior.
skin, thin skin, because thick skin is on your palms and on your soles, and it doesn't have the hair follicles. So this right here is the thin skin. Unfortunately, the picture that I put here, you cannot see the epithelium, right? It's cut off on this picture, but it is there, stratified squamous keratinized epithelium. Okay, this is for sure thin skin. How could you name this epithelium, even in this magnification? What is this epithelium?
Stratified squamous.
For sure. It's very thick. Just a sec. It's very thick. It's, I don't know, I can see the cells here are a little bit flat. Of course, it's very difficult. I need to magnify, but still, they're very flat. But most importantly, is it keratinized or non-keratinized?
Non-keratinized.
No,
Very good. Because the top layer is lacking this dark line. Do you see here, there is a very visible dark line. Here, there is no dark line. What is this dark line? This is keratin. So this epithelium right here is a stratified squamous non-keratinized epithelium. This epithelium right here is keratinized. We're going to see which exactly, but it's keratinized. So how do you call this?
Mucosa.
Mucosa. We know that this is a lip. So which mucosa is this?
Lining.
Lining mucosa. If I put like this, what is this? Lamina propria. Yes, this is lamina propria right here because I'm only pointing to the lamina propria. You said this is mucosa, yes? What is this?
Salivary glands.
If I put like this, then yeah, this is salivary gland, but I put as a layer. So what is this?
Submucosa.
This is going to be the submucosa. And inside of the submucosa, we can see many salivary glands. Even with this magnification, you're able to say which ones are they. There are three types for them: serous, mucus, or mixed. Which ones?
Mucus.
Take a look. There's lots of basophilic acini here present as well. And there are lots of pale acini present here as well. These are mixed. Okay, so these are going to be the mixed salivary glands. How would you name them? Let's see if your Latin was good. How would you name them? They're in the lip. They're inside the lip. Okay, so these are going to be labial. Okay, because labia in Latin is going to be a lip. So these these salivary glands are known as the labial salivary glands. Inside of the lip here, we can see a big muscle. Okay, I'm trying to outline it for you. Okay, so this is a big muscle right here. You can see with this magnification that I know this is a muscle because those are the skeletal muscle bundles. They're very nicely visible right here. So this muscle right here, this is of course orbicularis oris muscle. And now a question for you guys. What is this? Between your, between this segment and the muscle, what is this?
Connective tissue.
Yes, but say better. Knowing that this is the skin. This is actually hypodermis. Okay, because skin has 3 layers. It has epidermis, dermis, and hypodermis. You're absolutely right to say that this is a connective tissue, but to be more specific, you should say hypodermis. And notice that this hypodermis has very little of the adipocytes. They're barely visible here because that's not a normal place for adipocytes, right? So right under our lip, this is not the place to have the fat tissue there. Okay, so here you go. Cutaneous segment, lining mucosa. This is the red zone, right? These are the salivary glands. This is the orbicularis oris. So let's take a look at each segment individually. So this is a little tiny piece of the lining mucosa segment, right? So all of this right here, this is your lining mucosa. How do we call this layer?
Stratum basale.
Very good. This is a stratum basale of the epithelium. Until here, this is going to be,
Polygonale.
yes, because you can see that the epithelial cells here, they're looking very weird. Do you see? They have like 1, 2, 3 angles. 1, 2, 3 angles. They have many angles. They're polygonale. And the top layer,
Plant cellular.
plant cellulare, very good. You can see that in the plant cellulare layer, what are these dark dots?
Nucleus.
Nuclei, of course. So these nuclei are the evidence that this epithelium is non-keratinized, right? So this is for sure non-keratinized epithelium. What is this layer right here?
Lamina propria.
Very good. This is lamina propria. You need to remember that lamina propria is a loose connective tissue. Okay, if they ask you to classify it, it is a loose connective tissue that has lots of these cells. Unfortunately, you can only see the nuclei, but these cells are
Lymphocytes.
lymphocytes. Okay, you can see that there's some kind of blood vessels here, right? So these are some kind of venules. This is probably, cannot see the magnification, but it looks like it doesn't have the adventitia, so it looks like some kind of arteriole. Okay, another arteriole right here, etc. Submucosal salivary glands, we talked about them, that they're mixed. Okay, why are they exocrine glands? Why are they considered to be exocrine?
Because they contain ducts.
Very good. This semester, we're going to talk a lot about ducts. This is a duct, right? So this is a duct. This is also a duct. This is another duct. These ducts are the proof that this is an exocrine gland, because endocrine glands, as you remember, do not possess the ducts. They secrete their secretions directly onto the blood. Which acinus is this?
Serous acinus.
It's very pale, as you can see. So this is mucus acinus. Which acinus is this? This is the serous, right? So this is the serous acinus. What is this? What is this red thing?
Collagen fibers.
But how do we call it? I think Roshan has said it before. This is the connective tissue stroma, right? So stroma is just supporting connective tissue that is piercing your entire gland right here. So this is connective tissue stroma. Okay. Okay. So the same idea, just a bit of a close up, right? So ducts right here, serous acini, and cannot see a mucus acinus. What is this?
Myoepithelial cell.
Perfect. This is a myoepithelial cell. Very good example of it, right? So sitting right on the top of the serous acinus, this is a myoepithelial cell. It helps to push the secretions out, right? Okay, cutaneous. How do you know that this is a cutaneous segment? Several reasons. First of all, hair follicles. If hair follicles are present, this is a thin skin. If it is a thin skin, it's going to have how many layers?
4.
4.
4. Okay, let's do it. The bottom layer is called
Basale.
Basale.
basale. Okay, the next one until here is called
Stratum spinosum,
spinosum. Okay, this dark line right here is called
granulosum,
granulosum, and the top layer is
Stratum corneum.
corneum. Where is the lucidum?
it's only in thick skins.
Only in the thick skin. And I repeat, this is a thin skin. How do you know that this is a thin skin? Once again, hair,
Hair.
hair follicles. Okay, what are these?
Sweat glands.
Say better. They are sweat glands, but what is their name? As you can see, they're right next to a hair follicle. This is a hair follicle, and this is
Sebaceous glands.
the sebaceous glands.
Sebaceous gland.
Sebaceous glands,
Yes, yes, yes. So these are the sebaceous glands. Could you tell me type of secretion?
Apocrine.
There are 3 types of secretions. We have the merocrine, apocrine, and holocrine. Which one is here?
Holocrine,
Holocrine. What does holocrine means?
apoptosis,
Very good. Sebaceous sweat glands, do you see? They're dying. Do you see? Nuclei are disappearing slowly. Here we have nice nuclei. Here we have no nuclei whatsoever. The cells are literally killing themselves in order to release the sebum. Sebum is the oil which is covering the hair, right? So this is what we see here. Very important question that I forgot to ask. I go back all the way here. Type of secretion for these acini. These are mucous serous acini. So what is their type of secretion?
Merocrine.
Merocrine. Could you describe me merocrine?
The
Exocytosis. Perfect. Just one word. Merocrine, exocytosis. Exocytosis means that you're putting a substance into a vesicle. This vesicle fuses with the plasma membrane and releases the content. What is the difference between merocrine and apocrine?
part of the cytoplasm goes with apocrine.
Exactly. So part of the plasma membrane, not the cytoplasm, but plasma membrane. Main difference between merocrine and apocrine, in the merocrine, the vesicle lives by itself. That's it. In the apocrine, this vesicle is coated in the plasma membrane. So every time a cell secretes something via apocrine secretion, it loses a little bit of its plasma membrane, right? So every time it secretes, a little bit of the plasma membrane goes away with it. Okay, so sebaceous, we have talked about it. Here we can see the transition between the mucosal and the red zone, right? So this is the lining mucosa, this is the vermilion zone, and you need to see that the transition is abrupt. Remember this word. So it's not a gradual transition, it's abrupt. And we can see this transition very well with a naked eye, especially when you're dehydrated. Okay, so after this lesson, go to the mirror, pull your lip down like this, okay, and you're gonna see that the lining mucosa is shiny, has very shiny appearance, while your red zone is like a matte, okay, so it has no shine to it whatsoever, and between them there's literally a line, like literally you can see a line. So this line is right here. There is something which is called a vermilion border. Where is the vermilion border? It's not here. It's between a red zone and cutaneous zone. Okay, so do not make me go back all the way here. Vermilion border is this. It's the outline of your lips, basically. Okay, so the outline of the lips, this is the vermilion border. So In the self-control test, they're gonna make you confused. They're gonna put here an arrow, and they're gonna say that this is vermilion border. Are you gonna choose it as a correct option? No, because vermilion border is between red and cutaneous. Cutaneous is on its other end. So here it would have been a vermilion border. This area right here is a lining mucosa, right? It has a border, but it has no name. So is it clear, or did I confuse you? Where is vermilion border exactly?
Between
The upper
the
lips.
yes.
Between the red and the cutaneous skin. Between the red and the skin. Between the red and the mucosa, the transition is abrupt. It does look like a border, but it doesn't have a name. Okay, finally, red zone. You're gonna see lots and lots of questions here. In some areas, it is parakeratinized epithelium. In some areas, it is keratinized. Okay, so parakeratinized, you can see pycnotic nuclei, right? So this is the pycnotic nucleus here as well. And here it's very nicely visible pycnotic nuclei, right? But in some area, it's just keratinized. It is this question is the question like for a million, because every professor says something else. You're gonna see it, okay? So Professor Rosa says that this entire epithelium is parakeratinized. Professor Clara says that this is keratinized with the regions of parakeratinized. So they can never agree on it. I cannot tell you what to say. In the oral examination, always be smart. You say something, you look at their reaction. If you see that they do not like what you said, immediately correct yourself. Be like, in some books, it says that it's actually parakeratinized. And then the reaction will go back to happy and you pass, right? So you're gonna see that there are lots of questions like that in oral where every professor says something else. That's why this department is not a good department, because they can never agree on anything. Okay, so for self-control test, they are not going to make you choose, is this only parakeratinized? Is this only keratinized? We're gonna stick to the lectures and the book for the self-control test, and there it says that this epithelium is keratinized. Okay, this epithelium is keratinized with some islands of parakeratinized epithelium in it. Clear? Okay, this is keratinized epithelium, understandable. If this is keratinized epithelium, what is its other name? This is a question by Professor Rosa in the oral. Let's see how long it will take you to answer. If this is a keratinized epithelium of the red zone, what is its other name? Turn
Skin.
on you. Sorry?
Skin.
Say better.
Epidermis.
Epidermis. Absolutely correct. This is epidermis. This is the keratinized epithelium of the red zone. I told you, whenever you hear keratinized, you think skin. But this is a very special type of skin. It's not thin, it's not thick, it is just your lip skin. Because do you see any hair follicles nearby? Not really. Okay, so this is not a thin, this is not a thick, this is just red zone skin. These structures right here have names. Okay, so these ones, they are called papilla. And we call them dermal papillas. Because technically, if this is epidermis, the next layer is dermis. This area right here is your dermis. Maybe you know, maybe you don't know, but dermis is the place where we have blood vessels and nerve fibers, right? So this is the area where all of those structures are present. Dermal papillas of the red zone are very special because they are extremely vascular, extremely. So the same dermal papilla are present in your fingertips. That have the fingerprint. But those dermal papillas aren't vascular. These ones are. So I repeat, do not confuse yourself. Dermal papilla are not limited to your lip. We do not only have them in the lips. We also have them in the skin, like at your fingertip. The main difference between them is that this dermal papilla are very vascular, hence the lip color is of a red shade, right? It can be pink, it can be a bit darker than red, but still the red color is there. So you're gonna see that this is the reason, because it is highly, highly vascular. Very weird question for the oral. If I ask you, what is dermal papilla? What would you say?
It's like a hole in the epidermis.
Not a hole, and the opposite of a hole, because hole is like this, but this is like this.
Like a
An
lump.
opening.
Not an opening, protrusion. Okay, so protrusion, something that is pushing forward. Because do you see, this is the dermis right here. That's technically the border of the dermis. Do you see that in the dermal papilla, it protrudes into the epidermis? So very important, but very weird question. What is dermal papilla? The word papilla itself means protrusion. So this is a protrusion of the dermis into the epidermis. Is it clear? Okay, let's take a look at the tongue. So this is anatomical view of it. How do we call this surface of the tongue?
Dorsal.
Dorsal. The one which is under it is
Visceral.
ventral. Okay, and the one which is under it, the ventral, is lined by the lining mucosa, while the dorsal one is lined by the specialized mucosa, right? Specialized mucosa also has papilla. What did I tell you papilla is?
Protrusion.
Protrusion.
Of the dermis.
Hold on, protrusion. If I say dermal papilla, this is a protrusion of the dermis. But if I say tongue papilla, they are the protrusions of the specialized mucosa. You're gonna see this word in histo is everywhere. We have so many protrusions in our body, and unfortunately we call them papilla. So do not think that papilla is only in the skin. We have them everywhere, especially on your tongue. These protrusions, these papilla, they are protrusions of the specialized mucosa. There are 4 of them. They're called filiform papilla, fungiform papilla, foliate papilla, and circumvallate papilla. 4 types of protrusions of specialized mucosa. Take a look. This mucosa also does not have submucosal layer, the same as the masticatory one. We said that masticatory one was attaching to the bone, right? This one will be attaching to the muscle, because what is in the core of your tongue? In the core of it, we have a bunch of skeletal muscle. So this specialized mucosa will be attaching to that. Anatomy. Grossly, the superior or dorsal surface of the tongue is divided into 2, thanks to this foramen cecum structure. From the foramen cecum, you draw like this, like a triangular looking area. This is the anterior 2/3 of the tongue, and this is the posterior 1/3 of the tongue. In embryology, we're going to learn, and in anatomy, we're also going to learn that the 2 parts of the tongue have different innervation. Anybody knows what innervates the posterior 1/3 of the tongue? Which nerve? Which nerve is this? This is glossopharyngeal. You have learned cranial nerves last semester, right? Right? For the skull, you have learned them. Okay, because it's very important this semester. So 9th is the glossopharyngeal. Glossopharyngeal nerve supplies sensory innervation to the posterior 1/3 of the tongue. Keyword sensory. So taste. Okay, taste is going to be in the posterior 1/3 by the glossopharyngeal. What about anterior 2/3? Which one is this?
Trigeminal nerve.
Trigeminal. And if I'm going to put it like this, 5-3, what does it mean?
Mandibular.
Mandibular division, exactly. So this is the trigeminal nerve, mandibular division. The nerve itself has a name, it's called lingual nerve. Okay, so this is the sensory innervation of the anterior 2/3. But the entire tongue also has additional innervation by the facial. And facial nerve is very important for taste buds. So in addition to having sensory innervation everywhere in the tongue, you have special sensory innervation by the facial. Anybody knows the name of the nerve? Because it's very important. Which nerve innervates the taste buds? It's in your ear. That's why it's called cord of the middle ear cavity, because that's where it passes. It's called chorda tympani. Have you ever heard it? Chorda tympani? No? Okay, so this is a very important branch of the facial nerve that innervates our taste buds. So I repeat, how many papilla are in the tongue, on the tongue, sorry? How many types of papilla are on the tongue?
4.
4. What are they called? They're called filiform, fungiform, foliate, and circumvallate papilla. These papilla are protrusions of specialized mucosa. What is so special about this mucosa? It possesses taste buds. Most importantly, there's one papilla that doesn't have any taste buds whatsoever. This is called filiform. Filiform papilla are the only papilla of specialized mucosa that lacks the taste buds. Do you see the logic in it? Specialized mucosa is called special because it has the taste buds, right? Filiform is a protrusion of specialized mucosa, but it doesn't have the taste buds. This is the exception of the rule. Are they going to ask about it? Of course. It's a very important rule of exception, right? So filiform are the only protrusions of the specialized mucosa that lack the taste buds. Where are they present? Everywhere. You're going to see that filiform papilla are present everywhere on your tongue because they have a mechanical role. They're used for scraping. Have you ever seen a tongue of a cat? Or of a dog? Okay, yes. Have you seen it has those spiky little things that is coming out from the tongue? These are filiform papilla. These are the same filiform papilla that we have. But ours, through evolution, did not become that big. Why? Because thanks to the invention of shower. Okay, you can go shower. You don't need to scrape the dirt off your external orifices. Okay, so filiform papillas, they are conical in shape. They're shaped like this. Why? So it's easier to clean yourself, to groom yourself. This is why, as humans, do we need filiform papilla? Not really. Okay, so as a result, they are very small. You can still see them though. So homework for you after this class, go to the mirror, stick your tongue out, really look at it, and you're gonna see the filiform papilla there. They're very, very tiny. Fungiform papilla are mushroom shaped, okay? Typically we have them at the tip and they have the taste buds, okay? So we can see them as the little tiny white spots. So the white spots are the fungiform papilla because they look like mushrooms, right? Fungi means mushroom. Foliate papillas are located on the lateral surfaces of the tongue. They are parallel ridges of some sort. They also have taste buds. Fun fact, the older you are, the less visible they become. So again, homework for you, stick your tongue out. Do you see foliate papilla? You're young. If you don't see them, you're relatively old. I don't see them. Circumvallate are the biggest ones, clearly visible. As you can see, they are located right in front of this imaginary line that we have drawn. By the way, this imaginary line is called sulcus terminalis in anatomy. Okay, so this triangular line right here, it's called sulcus terminalis. So your circumvallate papillas are present anteriorly to the sulcus terminalis. There are 8 to 12 of them. They are huge. They're so big. And most importantly, they have clefts. I don't want to talk about it right now. I want to just show it to you on the picture, okay? So take a look. Which papilla is this? This is a filiform papilla. How do you know? Because it has this particular conical shape, right? It looks like a cone. So this cone is very useful for mechanical function, for scraping off the dirt, for licking yourself, and etc. Does it have taste buds? No, because again, it is a mechanical role. Which one is this? This is a fungiform because it more or less looks like a mushroom, right? Take a look. Its borders are quite intact. The epithelium continues. There is no cleft. Take a look here. What do you see? Do you see this deepening? This deepening is called cleft. And this cleft is the thing that will help you to identify a circumvallate papilla. Because do you see, it also looks like a mushroom, am I right? It looks like a mushroom to me as well. So how do I know that this is a fungiform and this is a circumvallate papilla? Always look for the cleft. If you see this deepening, if you see this cleft, this is the circumvallate papilla. If you see that the epithelium continues, right, it is very thick right here. This is a fungiform papilla. What is the issue with those clefts? They get dirty, okay? Food can accumulate here, food particles. If food particle accumulates here, bacteria will start to accumulate here. If bacteria are here, inflammation, right? So we don't want that. We need to clean the clefts. Who does it? Von Ebner's gland. Right under the circumvallate papilla, you're gonna see that there are lots and lots of serous salivary glands. There are lots of serous salivary glands. Serous salivary glands, are they making watery or viscous saliva? The serous ones.
Watery.
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 Because serous salivary glands make protein-rich saliva. Protein-rich saliva is watery. Mucous salivary glands have mucus. What is mucus? It's sugar. Sugar is viscous. Think of honey. Honey is very viscous because it's so sugary. So do you understand why we need serous salivary glands here? Because it's much easier to clean with water than with honey. So these von Ebner's glands possess ducts. And where do these ducts empty? Directly into these clefts to make sure that, like a hose, you're just cleaning this entire cleft to make sure that nothing accumulates in this area. So a question in the oral, how do you keep the clefts of the circumvallate papilla clean? Von Ebner's glands. Okay, always under the circumvallate papilla, you will find von Ebner's glands to clean that area. Is it clear? What is the type of secretion for von Ebner gland? It is a serous. So again, we have merocrine, apocrine, holocrine. Which one?
Merocrine.
Merocrine. Guys, always for serous, if you're secreting proteins, always merocrine. It's much easier to put a protein into a vesicle and just send it off. Okay, so exocytosis. So these von Ebner's glands are going to be definitely secreting via the merocrine secretion, type of secretion. These are foliate papillas. As you can see, they're ridges, right? Parallel ridges, very nicely arranged to one another. We do not have one in our slides. So this is a picture just for you. In our exam, you will not be able to see a foliate papillus because the section was taken from a different arrangement. So you will not see this. So it's just for you. Okay, let's talk about taste buds. So this structure right here is a taste bud. This is the epithelium, right? As you can see, the taste bud is within the epithelium. What is its shape? Very important, onion shape. You see this particular word, you know that they're talking about taste buds. There are three types of cells which are present in the taste bud. We have the receptor cells, supporting cells, and basal cells. This particular one, this is a basal cell because it's right there at the base. This is a stem cell, which is going to be giving rise to the receptor and supporting cells. On the sides, right here, there are cells which are supporting this entire structure. So how do we call it? We call them supporting cells. In the center, this is the place for the receptor cells. Receptor cells are neuroepithelial cells. And it's very important to remember that they are neuroepithelial cells type 2. What does it mean? Neuroepithelial cell type 2 is epithelial cell with the properties of a neuron. It means that it doesn't fire an action potential. It doesn't. It releases a neurotransmitter. Okay, so just how to say it? As you know, action potential is the movement of the ions. Am I right? So this is what action potential is. It's just a bunch of ions moving along the membrane. This does not happen here. So how does it initiate the action potential? By simply secreting a neurotransmitter. This neurotransmitter will bind to the nerve and initiate action potential. So if I have to simplify it for you, neuroepithelial cell type 2 does not propagate action potential. It simply initiates it. It starts it, but it doesn't propagate it. Do you understand the meaning of the word propagate, right? It doesn't continue the action potential. It doesn't. It simply starts it, and whatever happens, happens. Type 1 can propagate. Type 2 cannot propagate. So for your self-control test, this is a question. We're going to see it in the past paper session. Receptor cells are neuroepithelial cells type 2. This is not important. Next semester in neurohistology, we will talk about it. Okay. Receptor cells are connected by tight junctions, so it's very important. And they have microvilli on their surface. Why? to make sure that they can absorb more food particles. Because think about it, what starts the release of the neurotransmitter, right? So why suddenly receptor cell secretes the neurotransmitter and starts the action potential in the nerve fibers? Of course, it has to be the attachment of the food particle. So some kind of mechanical thing must happen for the release of the neurotransmitters. Very importantly, there is an opening here. This opening is called pore. Pore is the place where food particles go to, right? Fun fact, the more you chew, the tastier the food becomes. Why? Because when you're chewing, you're breaking the food into little tiny molecules, right? So not macromolecules, but like millimolecules, mini molecules. They can easier bind to the microvilli of the receptor cells. The action potential will be much stronger. So chew your food. Where else do we have the taste buds? Not only on your tongue, glossopalatine arch, soft palate, these structures are at the back of your mouth, right? So you remember the uvula hanging down? This is your soft palate. Right behind it, like this, there is the glossopalatine arch. Okay, so right behind it. Posterior surface of the epiglottis. So epiglottis is the place that, the flap that closes the trachea, right? And pharynx as well. So all of those places will also possess the taste buds. I forgot to ask you, which nerve is here? Because we said that receptor cells are sending neurotransmitter to a nerve, but to which nerve? Sorry? Somebody said something, sorry?
Pharyngeal?
I told you which nerve is for the taste buds specifically.
Glossopharyngeal?
Panic.
Facial. Facial nerve. You remember? Please don't make me go back, but facial nerve. Facial. Chorda tympani of the facial is for the taste buds. Just sensory sensation, like I'm touching right now my tongue, right? So this is my lingual right there from the trigeminal. The back of my throat, the same. But the taste itself is by neither, okay? It's by this one, by the part. Okay, I am wrong here, because if I'm talking about the taste buds at the back of my throat, glossopharyngeal will taste them, for sure. You're right. So technically, you could say here two of them, facial and glossopharyngeal. Yeah. Okay, so I'm always forgetting at the back of the throat, but yeah. So facial and glossopharyngeal if we're talking about a taste buds at the back. Okay, here we have just some taste, right? So you remember all the taste? Nothing important. In physio, you will talk a little bit about it, but to be honest with you, it's not important. Okay, so this is your tongue, H and E. Until here, which surface is this? This is ventral surface. Everything on the top is dorsal. Try to use your 3D vision a little bit, right? So this is the tip of the tongue right here. So this is the tip of the tongue. So that means that what is this right here?
Lining cells.
Lining mucosa. Okay, so this right here is going to be your lining mucosa. What about this on the surface? Specialized mucosa, very good. From here all the way until here, this is specialized mucosa. Is it attaching to submucosa? Is there submucosa?
No.
No. So both of these mucosas are attaching directly to the muscle. So all of this tissue right here, all of it, this is a muscle. Which kind of muscle?
Skeletal muscle.
Skeletal muscle. How do you know that this is a skeletal muscle? Well, again, I need the tongue to talk. Okay, I'm in control of my tongue right now, so definitely this is a skeletal muscle. What are these?
Serous acinus mucus.
Just together salivary gland, right? Even with this magnification, you can see absolutely right that there is serous acini, mucus acini. So this gland is a
Exocrine gland.
if you see both acini, we say which kind of gland is this?
Mucus.
You see both of them.
Mixed.
Mixed. This is a mixed salivary gland because you see both serous and mucus acini, right? And etc. Okay, most importantly that I forgot to mention, this slide is horrible. So whoever has made this slide, he was definitely in a rush because it's prepared absolutely horribly. You cannot see pretty much nothing. Okay, nothing can be seen here. So the easiest one that they will probably take a picture of for you in the exam is this one, because that's the most normal looking one. What is this?
Papilla.
But which one? Because we have 4.
Fungiform.
Fungiform. Yes. Okay, so this is a fungiform papilla right here. What about the one next to it? This one?
Filiform.
Filiform, because do you see it has a little bit of the conical looking shape. This one has a little bit of the fungi looking structure, right? So these things that you can see here, these are the tips of the filiform papillas. Okay, so this is a very good picture right here. So this is probably the body of the filiform, and this is the tip. Again, the section, the preparation was poorly performed, so you can barely see. All we see are the cross sections of the filiform, just their body parts. We don't see the superficial part whatsoever. Only on this part we can see, but that's it. We talked about salivary glands, so nothing important, right? So the mucus acini, the serous acini, the ducts, this is a mixed exocrine glands because it has the ducts. Now this slide is important because this is the one which is going to come up for sure. So this is your tongue, and what you can see here, what is this?
Circumvallate.
Yes, okay, so these are the circumvallate papillas. How do you know that these are circumvallates? Thanks to these deepenings right here, which are called
Clefts.
clefts. Okay, which epithelium is here? Sorry, which structure is here? What is this?
The specialized mucosa.
Specialized mucosa. What is this? So this whole thing is called circumvallate papilla. So what is this?
Specialized mucosa as well.
This is specialized mucosa, yes. But what is this? What does mucosa consist of?
Epithelium.
So what is this?
Epithelium.
Epithelium. What is this?
Lamina propria.
Lamina propria. So again, circumvallate papilla is a protrusion of the specialized mucosa. Do you see that this whole thing right here is a specialized mucosa? So they're always going to ask you this question: what is in the core of the circumvallate papilla? What is in the core of it?
Lamina propria.
Lamina propria. What is on the surface of it?
Epithelium.
Epithelium. Okay, so I know it looks very weird because this is specialized mucosa. So this, it looks like only here is specialized mucosa, but no. All of it, the entire circumvallate papilla is a protrusion. The entire thing protrudes. It's a protrusion of what? of specialized mucosa. That means that on the surface of it, epithelium, right? In the core of it, lamina propria. Okay, what are these? They're very dark in color. Take a look. This is a mucus gland right here. For comparison, it's quite pale. But what are these?
Serous glands.
Yes, how do we call them? They're emptying into this area right here.
Von
Von
Ebner.
Ebner.
Von Ebner, very good. Okay, so this is going to be von Ebner gland. Okay, von Ebner. So again, for comparison, right, this is the mucous salivary glands. These are going to be the serous salivary glands. Preparation is horrible because they look empty. I don't know why, but these are serous salivary glands. These are mucous. Do you see how pale? These are the serous ones. So again, this is your circumvallate papilla. This is specialized mucosa, right? The entire circumvallate papilla is a specialized mucosa. This is
Epithelium.
epithelium. This is
Lamina propria.
lamina propria. What are these? In the epithelium, what do you guys think?
Goblet cells.
No. Goblet cells are only in your gastrointestinal tract. Yeah, like in your small intestine, large intestine, etc. They are onion shaped.
Taste buds.
Taste buds. Yes, these little tiny pale looking structures in the epithelium, these are the taste buds, right? So this is the cleft. This is the serous von Ebner's glands. They secrete the clear looking fluid to clear this particular area. These are the ducts of the von Ebner's glands, right? So acini and ducts. You can see that the ducts, they look different. Okay, so circumvallate papilla, epithelium, lamina propria. Which epithelium?
Non-keratinized squamous.
Stratified squamous, non-keratinized epithelium. So this is the basale layer. Until here, this is the polygonale, and this is the plancellulare. You can clearly see the nuclei on the superficial surface. So it's going to be non-keratinized epithelium. Yes, okay, so this is non-keratinized epithelium. Take a look in some areas, the nuclei are pycnotic. Do you see? Like here, it's very dark nucleus, very dark nucleus. So probably this area right here is parakeratinized epithelium. But again, we don't choose, like they're not going to make you choose this. So you're just going to say this is non-keratinized epithelium. Okay, how do you call these cells? In the center.
Receptor cells.
Which kind of cells are they?
Neuroepithelial.
Neuroepithelial cells, type
2.
Type 2, very important. On the periphery, we have
Support cells.
supporting cells. Do I need to explain what do supporting cells do? They support the taste bud. And at the bottom here, we have the basal cells. Basal cells are the stem cells that are giving rise to those two. Again, what is this?
Lamina propria.
Lamina propria, very important. Okay, I point, you tell me, what is this?
Cleft.
Cleft. How do you call this entire area?
Specialized mucosa.
Specialized mucosa. This?
Epithelium.
Epithelium. Which epithelium?
Non-keratinized.
Non-keratinized. Some places
Lamina
Lamina
propria.
Lamina
propria.
propria. What are those dark dots in lamina propria? I go back. What are these
Lymphocytes.
dark dots? Lymphocytes. Very good. Okay, so every single dark dot that you see here, this is a lymphocyte. What is this?
Ducts
Of?
of the serous glands.
Of the serous
Of the von Ebner. Okay, so don't forget the names. This is going to be the duct of the serous salivary gland, von Ebner, which is where? Which is here. Okay, so this is the von Ebner's salivary glands right here. Okay, this is for you when you're done with all of the papillas, right? So try to kind of test yourself, which is where, what is who. Okay, guys, I would like to stop here for today because it's enough for the first day. Okay, we're missing about 20 minutes, so I will be adding them to the other lessons. Okay, so some other lessons